So when looking at a patient's chart, one of the things that's difficult is to identify which documents are important and which ones are not. And so what that means is sometimes you end up searching through pages of charting, including billing and face sheets and coding to find the charts that you want. And so we're going to show you how to create custom filters to find only the notes that you're most interested in. So to do this, what we'll do is you'll hit the three dots here to launch the Advanced Filters dialog. And if you leave this filter here blank, it will prompt us at the end to create a new filter. And so I'm going to show you my typical emergency room filter, which would include ER physician notes, pre-arrival notes, admission histories, and discharge summaries, and a few other important things. So first we'll click on clinical documents. And you can see, you can kind of browse through here. There's lots of different types of documentation here. The first thing I want to add is cardiology. So a large number of patients obviously have prior EKGs, prior echoes, and so I want to include those in the system. I also want to include a stress test report because it's very often a patient comes in with chest pain and they either forget or they don't realize they've had a recent stress test. And so we can prevent potential admissions maybe by doing that. So next, I do also include some consultation notes, just because sometimes it can be helpful to see if you have a patient who had a complex admission recently, to see some of these. So the things that I usually include are surgery notes, infectious disease notes, and then the most important in my mind is palliative care notes. Patients who come in, you need to rapidly assess their goals of care. If they had a recent palliative care assessment while they're in the ER, or in the hospital, then that can be useful. Okay. I also include discharge summaries. A lot of times, if you have a bounce back, you want to know the date they were discharged, and it can provide a pretty good history of the patient. Next, I'll include my ED physician record, as well as the EMS report. I also want to include any pre-arrival notes, and that includes either call-ins from EMS or call-ins from physician offices as well. Next, my history and physical from prior admissions I include. And then that's really the most important bulk of what I include. The most helpful part is having the EKGs automatically populate into your filter. So now we're going to leave the rest of this blank. We're going to hit Save As. I'm going to call this ER Notes. Hit Save and Apply. Now it is added to our personal filters here. And in this case, the patient doesn't have any of these notes in their system except for a single history and physical.